Hi, everyone. This is Jennifer Bond with Nancy Bond Insurance Services, and we are here today during the ELEA office hours to talk about the open enrollment. By the way, ELEA has office hours regularly this same time every week. So if you ever have any burning questions for Corey or anything that you need help with, she's available and it's a great opportunity. And today we're going to talk about the open enrollment for the insurance benefits. We are the benefits administrators for the ELEA, and there's a handful of insurance policies and plans that your employees have access to. As ELEA members, you have the opportunity to place your employees in amazing situations for protecting their family. Life insurance, long-term disability insurance, dental, 2 plans for dental insurance, and vision insurance. In addition to that, every ELEA member school and center has a free accidental death and dismemberment policy. And that comes free to you through your membership, and all employees who work 20 hours or more, that's the eligibility. Those that work 20, both church and school, have access to the accidental death and dismemberment plan. The other benefits, it's open enrollment right now, which means that those that haven't enrolled before can enroll now without medical underwriting. So I want to show you how to locate all the details about this. So I'm going to go to the ELEA website. So it's elcaschools.org/insurance-programs. Or if you're on our homepage, elcaschools.org, go to resources and go down to insurance programs here. So you're going to see it's open enrollment, and it's going to say 2022 benefits this week. It's 2021 now, and we're thinking forward to 2022. I can't believe it. Okay, all right, I can't think too much about that. So this year, there are no rate or plan changes at all. Everything's staying the same as last year. Those that are enrolled now, if you notice on all of these hyperlinks right here, disability, life, dental, vision, those are the plan summaries. And those include the rates and the coverages. The only change that anyone would experience is an increase in the rate because you're aging up into the next bracket. There are certain types of plans that have an increase here. So the disability insurance, I'm going to click on this and it's going to load right away the plan summary, voluntary long-term disability. And when you scroll down, and these are all those links here, going back, these are all, when you click on it, it will let you download a PDF or load a PDF of the plan summary. And here we go. There we go, I'm back. And each plan has the information. So long-term disability describes the plan itself. Long-term disability specifically has a waiting period, an elimination period of 90 consecutive days. That means that you have to be disabled due to injury or sickness before the benefits begin. And so that's a 90-day wait after having a disability. And anything before that, you would need to look into short-term disability, and that would be done separately here. But I wanted to scroll down and show you how to find the rates. So this is where to find the long-term disability rates. So we can see here are the age brackets, so to speak, 25 to 29, 30 to 34, and you can see your monthly salary or wage, the monthly amount, go down to your age, and you can see what the monthly amount would be. So as you can see, the rates are incredibly low to have a really, this really good protection. Long-term disability is paycheck insurance. So if you're disabled, it will pay for a portion of 60% specifically of your regular salary. So I'm going to go back here, and we'll, the life insurance, dental high, dental low, and vision, those plans are all in open enrollment right now. So I encourage you to go to this website and check it out. Step one is to distribute the information, review the plan summaries with everybody. And just like the accidental death and dismemberment plan, the 20 hours or more is the eligibility. The same for the rest of the plans. So those that work 20 hours or more per week can enroll. And that's, again, both church and school. So everybody's eligible. Step two is to apply. Now, I want to introduce you to Monica on my team. When you have reviewed, hi Monica, that's Monica Cordero. She's our life and health insurance account manager expert here at Nancy Bond Insurance. So step two is to enroll, to send the applications to Monica. So you'll see here at step two on the website, the form there's one form for you as the employer, and that's the billing form. I'll get back to that. The second is the form for employees to apply. So this insurance application here, I'm going to load that on the screen. And you would fill this, the employee would fill this out. Dependents can enroll in you can do spouse life insurance, child life insurance, and children and your family can enroll too in the dental and vision with you. You have to enroll in order for them to, and the rates again are back on the rates are within this information here. And getting back to this, pardon me. There we go. Here's the application. Getting mixed up here. Just a moment. There. Here we are. So on this application, we need the employee's signature and the date. We need to know what they're enrolling in. And here's the section for the coverage for dependents on number 17. Be sure to fill out their annual earnings, especially if they're enrolling in long-term disability. And here we go, scrolling down here. On the second page, if you're enrolling in a plan, if an employee is enrolling in some and not others, so say for instance, somebody is enrolling in life insurance, but not disability, dental, or vision, be sure to write in what they're declining and have the employee sign. Now, if your employees aren't enrolling in any plans at all, have them fill this out anyway. You can keep that in the office. So you can say, we did offer it to all and we received the declinations. They didn't want to do this. Now, as far as premiums go, we want to say, we want to remind you that these are called voluntary plans, and that means that the employees pay the premiums. Now, how do they pay the premiums? They pay through payroll deduction, where we tell you all what each employee's monthly premium is going to cost, and then you will tell your payroll person or department that amount so that they can process that through payroll deduction. Once a month, our office will bill your organization with a total of all of the enrolled employees' premiums. And the way that we do this is with this pre-authorized payment form. So that we will charge your organization once a month by ACH. And it's automatic. We tell you exactly what the amount is going to be. And so this is the form that we also need to accompany any new application. If you already have insurance through us, and if you already have employees enrolled in these benefits with us, we don't need it again. And we don't need new applications for those that aren't making any changes. But for those schools and centers and churches that are new to us, that is when we need this form. And step 3 right here, we will send proof of insurance for every employee and a spreadsheet to you showing the billing to anticipate that amount, the spreadsheet that shows each employee's premiums per month. Now I'm going to refresh the screen and we're going to see it is 2022. Yay. All right, so the deadline to apply is December 1st. So the whole month of November, it's open enrollment. So I highly recommend to just make sure you can distribute this maybe this week or next week. Maybe give your employees a deadline to respond to you before Thanksgiving, that holiday. I know when I'm given a decision to make or something to review, it's, I'll think about it and then I'll say, I'm going to do it next week, or I'll think about it next week. And then the deadline rolls around, I get the email and it's, oh my goodness, it's December 1st already. I didn't respond to that, but I really want it. We just encourage you to fit in some time to talk to everybody about this, distribute the materials, watch for the ELEA newsletters, the Schools Connect, connect with other directors, asking questions. Maybe they have methods of distributing this to their staff. And now this is available for everyone across the country. I wanted to also note that one question we get quite often, and I will unshare for a second to give you my face. We get a lot of these questions. Medical insurance is not available through this through ELEA membership. Medical insurance after the Affordable Care Act made affordable medical plans be state specific, state by state. So each of you within your respective states need to apply from a broker or from the state exchange. If you have that, go to healthcaregov or contact a local medical insurance broker. That is the best way to obtain medical insurance for the group medical for your organization. The plans vary, the medical providers vary state by state, but the life insurance, long-term disability, dental and vision, that's pretty standard across the country. So that's one note about the medical insurance. Let me do one more screen share here. And
Jennifer, can I ask you a quick question about
of
the
course.
healthcare.gov? Is there,
Yes.
are you or Monica familiar enough with those policies and navigating that site to assist people if they want some assistance on just understanding everything that's available on that website?
It's so complicated. We can, and the tough part is that it's complicated. The answer is maybe. Every state will have a different way to apply. Some states work with healthcare.gov. Other states have their own website and their own exchange. For instance, California has coveredcalifornia.com. Colorado has Connect for Health Colorado. The states that don't want to create their own system to participate in the ACA, they have to use healthcare.gov. It's so complicated. It's hard for a broker, to be able to really know it unless you are there. So we recommend to contact a local broker to you for that. We can help in California, and for those, for individuals that need help applying for insurance through the exchange. If anybody, if you work at a place that does not offer group health insurance and you need to apply as an individual or apply for your family outside of a group, if you're in California, please call us. And you can call Monica, and the phone number is 800-685-4519. It's also on that ELCA Schools insurance benefits page. But give us a call and we can help, kind of direct you to the right next place to go. So that's the way to do that. So it's complicated, but there are options. And I recommend to find a benefits or medical insurance broker. It's a really busy time because it's open enrollment for that right now too. for January 1st. So if the earlier you can connect with somebody locally to you, the better, because it's going to be a very busy time, but it's really important to be covered. Yeah.
Absolutely. Thank you.
Yeah. Let's see. I was going to, let me see where I was here. I'm scrolling down a little bit further. There's some additional benefits that come with the life, long-term disability, dental, and vision enrollment. The free benefits of insurance here, there's an employee assistance program. The rest are very important to look at. So do click through, but I'm going to show you just one. The Employee Assistance Program, or EAP. And now that's available for anybody enrolling in any of it. And there's counseling services, family caregiving services, so referrals for elder care, special needs services, legal services. So you get a free phone call or consultation with an attorney, financial services, convenience services. So recommendations for cleaning services, to travel, and some online information too. So this is really helpful because it, in a really stressful time, especially approaching the holidays, and that there's still a pandemic that we're dealing with, and with a lot of the stress and strain that employees are feeling, this might be a really good thing to connect them with. For those that enroll, we will mail this the information about this. I also, so yes, please look into this. Make sure you tell your employees about it. I want to also show KCL, Kansas City Life is the insurance company for these benefits. And on the Kansas City Life website, which is kclgroupbenefits.com, you'll find here that you can find the dental and vision providers. So if this will also be in the materials that we send the employees, so they can download their ID cards and find providers. I want to show you that this is available to you. So under employees, there's dental provider search, where you can search by dentists around your area. You can download it as a PDF when you're done. The network is very broad. So in most areas, I haven't found an area that doesn't have at least 10 dentists, in a 5 to 15 mile radius that accept the plans. And then there's the vision provider directory right under that. So under vision provider, click VSP and not Davis. VSP is the network, and this will link to the VSP website. All right, and then lastly, request a dental or vision ID card. When you click on that, and we send instructions of how to do this, but you would the employee would type in their social security number, and the group number will be available, and that's 25515. And when you hit submit, it will link to a PDF to download. That is your ID card for dental and for vision. And that is what I wanted to share. Let's see, if you find you have more questions after reviewing our program today, please reach out. Our website has our contact information. You can reach us at Jennifer@nancybondinsurance.com, Monica@nancybondinsurance.com, and our toll-free number again is 800-685-4519. And the deadline again is December 1st to enroll in the life insurance, long-term disability, and dental and vision. Any questions? Corey, Monica, anything you'd like me to add?
Awesome.
I think you covered it
Thank
all.
you.
Thank you.
Cool. All right, thanks.
I have a quick question for you. So as you were going through that last form, that EAP, the link on the bottom, And I know that's a form from them, but when I click on the website and use that company code, it doesn't really let me do anything. Is it supposed to let me do something?
Let's see, CL EAP. I'm going to try it right now. Oh, I lost it. All right, KCL EAP, the number 5. Let me try it here. And it may just be we need a new updated code.
Okay.
And it's the program for the EAP is, now this isn't anything anyone needs to remember, but it's called KE Pro or KePro.
Okay.
It loaded for me. I'll share my screen again. Let's see. It loads this screen.
Okay.
And this is where you can locate your counselor, providers, mental health. So I'll go through that again. So this website here, so this is the EAP flyer.
Yeah.
And go to eaphelplink.com. And the company code is KLEAP5. No, KCL EAP5. And here's that site. Yeah, so that's how to
mine is
locate that.
going. I think I copied and pasted it and it must have grabbed a space in front of the K.
Gotcha.
Because I typed as you were talking and then it went. Okay, perfect. I just wanted to make sure we weren't dealing with a broken link there.
A broken link, yes.
So, okay.
Yeah, so this is really good information. You know, and there's so much information about the plans themselves to talk about that we often run out of time to talk about this, but this is pretty helpful. You know, I just remember being in my 20s and working at an early childhood center and just being so stressed out and going through college and you know, I had 2 jobs and just thinking about if I had, you know, free access to counseling, especially through somebody that I didn't know, you know, maybe you don't want to go to the counselor that your boss or that your mom wants you to go to. This is something that's a third party and that can be something that you seek out. I think this would have been really helpful for me back then. And now I'm very well adjusted. So
Congratulations.
Thanks. But this is a really good program.
Yeah, and one that I often overlook as well. I mean, just so many resources available there.
Yeah. Oh, and you know, just since we're here, here's the section for the free accidental death and dismemberment insurance. So everybody gets a $3,000 plan. The way to apply is that you would download a spreadsheet, or it's a registration form. One's in Excel, one's in a PDF, and you can put all of the employees' names that work 20 hours or more. So that's really important to think about there. All right, and here we go.